A lot of women struggle to lose weight after having a baby, but there is a new way to shed the pounds. Today, Dr. Randall Weil joins us with one of his patients, Sarah, to talk about a new procedure called the Mom's Body Tune-Up. Thanks so much for joining us today.
Thank you.
Now, this surgery is designed to help, I guess, mothers get their bodies back, in a sense?
Yes, basically that's it. So really, no two moms are pretty much the same. So I see a lot of people, a lot of moms that have different things that bother them. And in Sarah's case, it was the saddlebags that bothered her. She's in good shape, but there are certain areas that in some people that are difficult to remove.
Okay, now, Sarah, in your case, you just had this done recently, I mean, within the last week.
Yes, exactly.
And tell us what you had done. I mean, to me, you look great. You're thin.
Thank
you, for some reason, felt you had saddlebags.
Well, I lead a healthy lifestyle. I eat right, I exercise, so I take care of myself. But there are, I've noticed over time, certain areas that you just don't have any control. They don't get firmer, they don't get tighter. And that was the saddlebag area for me, and it was something that would bother me, and I was self-conscious about. And when I talked to Dr. Weil and found out there was something that was minimally invasive that you could do that doesn't have virtually no downtime, zero downtime for me, so I opted to help remove some of the fat.
And doctor, maybe you can, right now we're looking at some video.
Sure.
This is actually you, Sarah. Not an enormous amount that you want to be taken away there.
This is a minimal amount, but a lot of times it just kind of bothers them. And you can see this is the area in the saddlebag that kind of bothered her. So these are small procedures. We call them minimally invasive. It can be done in office, really under a local anesthetic, and may take an hour or so to do. People go right home.
So is it a type of liposuction?
This is a type of liposuction, exactly.
And it's
exactly
in
right.
office?
Sure. We can do this to the saddlebag, you can do this to the stomach, you can do it to the neck, we can do small things to the breast. So.
Now, what is the advantage of doing this as opposed to, Sarah's young, you know, so many people, you know, watch what you eat, exercise. This, of course, I understand, is a quicker fix. But I mean, lasting effects. Sarah, you're still young, you could have more children. Our bodies change as well. You know, what do you really feel the advantages to doing this instead?
To do it this way, I think basically just what you said. It is kind of a quick fix for people. Moms are busy, they don't have a lot of time maybe to spend at the gym, maybe 2-3 hours a day. Something like this may be able to be taken off with exercise, but it's extremely difficult. So a lot of times they just want something that's fairly simple.
Well, Sarah, I noticed you nodded your head as well when he said moms are busy.
Exactly.
Is that part of it?
Oh,
I mean,
absolutely.
Finding time to exercise is tough?
I work a normal 8-hour day, sometimes longer, but also in conjunction, I have responsibility as a mom, as a wife, and run a home. And yes, struggling to get to the gym on a regular basis is an effort. So I don't look at it as a shortcut for cheating, but I look at it as an opportunity to kind of give me a little bit of a jump start or help me not feel so bad or guilty about not making it that 3 times a week to exercise or
Do you have concerns of whether your body's going to change again if you do have more children, or just as we age, things start to hang in places you don't want them to? I mean, you know, it's all natural.
I think that for me, just knowing me personally, that I am committed to a healthy lifestyle, I'll be able to probably maintain, and if I do decide at a different point in time to have more children, which is not where I'm at right now, then I would have to readdress it, and I'm not sure, but if it's something I could repeat because it was so easy, not a lot of discomfort and no downtime, it's something that I could maybe explore if needed ever again.
And right now we understand that you're wearing some kind of support right now. How long does she have to do that?
Usually about 3 weeks, 2-3 weeks. People should just.
What about bruising or whatnot, or any complications associated with this?
I'd say bruising is probably the most common complication. We always have to worry about the contouring with liposuction.
All right. And what does this run?
This would run about $3,000 in office.
Okay. And quickly, I'm just showing some other options that are available as well.
Sure.
In this is the before, of course.
This is a mom. Actually, her child was like 14, but she just didn't have the time to go ahead and get rid of those particular areas that really bothered her.
Your unmen, we call them love handles type of things.
Exactly.
And then this is the after picture as well.
Exactly.
So many different forms that you can take. And this is lasting? I mean, as long as, obviously, the patient watches their weight and exercises and whatnot.
Right. If you maintain a fairly healthy lifestyle, it's going to be long-lasting.
And it depends on the procedure of how much it's going to cost?
Absolutely.
And give us a range?
Sure. A lot of times in office it may be $3,000-4,000. If you go in hospital, it maybe do something like a major tune-up, a major overhaul. It can run $6,000-7,000.
Okay. All right. That gives you the motivation to keep it up and look good. Well, you look great anyway. But thank you both for joining us today.
Thank you.
Very nice talking to you.